You might have heard it called diastasis or diastasis recti. But what is it? Diastasis recti is a separation of your abdominal muscles. By the end of pregnancy, research shows that 100% of women have a separation of your abdominals. This is an adaptation that our bodies make in order to make room for baby. So if you think about your six-pack abs, which are not going to show unless you have not enough body fat to menstruate. So pack should be not your goal. But if you think of kind of where your six-pack abs are, that space in between is what separates. So one way to check to see if you have diastasis is to lie on your back. And that was a really good example of poor core control. Lying on your back, gently lift up and push your fingers down right below your belly button. Can you feel a separation between your abdominal muscles? So can you kind of bump your finger to one side and bump your finger on the other side? I can get basically one finger in between there. Maybe 1.5 down here. You can also check at your belly button level and then above your belly button. So here I don't really feel any separation. And down lower, I have a little bit more. Some people can get 2, 3, 4 fingers in between their abdominal muscles, and you can kind of like bump side to side. You want to check below your belly button, at your belly button level, and above. Anything like 2 to 2.5 fingers or less is functional. We consider it functional. And the other thing is that I also care about how deep down your fingers go. So if you can see here, I can't really push my finger down. Let me, if I relax. Yeah, I can't really push my finger down. Down here, I can push down a little bit more. So that means that down here, my transverse abdominis muscle isn't quite as firm and tight as up here. So functionally, I care more about how deep, or really how firm and shallow the separation is than how wide it is. Because if you have good core control, deep abdominal core control, even if you have a wide gap between your rectus abdominis, if your transverse abdominis engages well, it's going to be firm and you're not going to be able to push down very far. And that's those deep core muscles that we are really focusing on, really targeting, and really will help you function better, decrease back pain, decrease your pelvic floor symptoms. Let me sit up a little bit so I don't strain my neck. So in the community, well, first of all, I want you to kind of try this at home. If you feel comfortable in the community, tell me how much of a separation you have above your belly button, at the level of your belly button, and down low. If you want to email me individually and let me know, you can do that as well. Or just make a note of it yourself, and then I'd be curious to have you retest at the end of the program and kind of see how much firmer your stomach has gotten, so how deep you can push your fingers down, so the shallower the better. And if you notice any difference in how wide your separation has gotten. If you have any questions about how to test this, also feel free to reach out or drop them in the community. Sometimes it's really helpful to put your questions in the community because other people might have the same questions but are too afraid to ask, or didn't think about that question but really would like to know the answer. So I just really want to kind of promote the community aspect of this platform because I think it's a great way to learn with others and feel supported and like you're not going through this whole journey alone. The other thing I want to talk about in regards to diastasis is coning and doming. So sometimes if you don't have good core control, you will start to see coning. So you'll kind of, if you have a wide and or even if you don't have a firm diastasis, you'll start to see when you engage your muscles, mine doesn't cone, but it did when I was pregnant. You'll kind of see like it pop up here in between your abdominals. We want to avoid that during any exercise. So if you see any coning or bulging, I'll try and find a good YouTube video of it and add it to the coursework. If you see coning, that's a sign of poor core control, so we want to avoid that. And also doming. So if you're like bearing down to lift, so let me see. If I'm like pushing down like this and lifting, see how my belly pops up when I lift? That is a sign of poor core control, that you're bearing down and pushing into your pelvic floor. Instead, your goal when you do core exercises is to do that good breath in, out, exhale, zipper up and lift. Or do whatever motion you're doing with your extremity. So if I was in quadruped and I was doming and pushing out, you can kind of see how my belly bread loafs here versus drawing in and performing the exercise. So if you need to film yourself doing some of these exercises to see what you're doing, sometimes that video feedback is really helpful because you don't even realize the compensations that you're doing because your body is just so used to it. You have that muscle memory. So if you don't know or can't feel if you are compensating, take some video of yourself and watch it. If you don't know what you're looking at, feel free to send it to me and I can kind of put a couple pointers on your videos and make sure that you're doing everything properly. All right, if you have any more questions, feel free to reach out. Have a good rest of your day.